Okay, hi guys. My name is Kailey Davies.
And hi, my name is Nidhi Vedati.
We're both third-year pharmacy students, also in the Pharmacy Business Administration ARCO here. And this semester we completed a special topics as clinical strategy interns with the startup Korion Health. So Korion Health is a healthcare technology startup which really focuses on improving patient-centered care from the convenience of their own homes and allowing patients to kind of take charge of their own health. So this semester we focused on helping them with their founding product, which is an electronic smart stethoscope that will allow patients to record their heart sounds within their own homes on their own devices. And I just included the company mission because I think it's really important to kind of keep healthcare patient-centered in the realm of startups and business and everything, and this company is really keeping that in focus. Okay, so throughout the semester, we helped them conduct some product market research. We helped develop their use cases and really form a stronger value proposition. And we got a lot of experience with different professional fields. We worked with FDA consultants, business financial teams. We saw the hardware and software development, which was super interesting. And we collaborated so much with professionals that we never really get the experience within the School of Pharmacy. So it was a really great experience. And then we also helped them gauge interest from other companies. So right now the focus is within telemedicine companies, since this is a home monitoring device. And so we got to kind of work and kind of do some research into other potential letters of intent for them.
So a big part of our project that ended up taking over the second half of the semester was our pitching experience. So we pitched for the Randall Family Big Idea competition at the Big Idea Center here on Pitt's campus. And so we were finalists in the competition. And this was a really unique experience that we had because it's an experience that we can have in the future as well, whether we move on to start our own startup company or have an idea, for example, like an independent pharmacy that has a unique idea that needs funding from investors. And we learned a lot of key components through this. Pitching is a skill that we really had to work on. It took a lot of YouTube videos and mentorship from Anna and Dr. Patel. And you have to work on being brief, but also getting to the point while really trying to sell your product about why it's different and one of the best compared to the other products on the market, as well as why you deserve funding for your product to move it forward. And another thing that we had to prepare was also all the questions that we may have gotten asked. So there were a lot of different sectors and a very diverse team that went into creating this product and that's still working on this product. And obviously we weren't involved in every sector, but we had to be prepared to answer all those questions that the judges had. So we definitely gained presentation skills, and we made a lot of important connections along the way and received feedback from founders of other startups that we will keep these connections moving forward and also maintain for advice in future startup competitions as well. So what we learned in our future steps, so first and foremost was the communication skills through the pitching. That was a unique skill and opportunity that we were really excited to have because it was both of our first times pitching anything. And a lot of interprofessional discipline because, like Kailey mentioned, we worked with a lot of different professions that we don't necessarily collaborate with in the pharmacy school. In pharmacy school, we really collaborate with other health sciences schools, but here we got to collaborate with engineers, business backgrounds, and many other schools around campus and across hospitals and other startups as well. And then there was a lot of independent project management. So along with managing our special topics deadlines, we also had to manage deadlines that we had with Korion as well as deadlines for the competition. So it really helped us with time management and in a way managing two schedules. And then just for how we will continue working with them. So we're currently working on conducting a clinical survey on home telehealth monitoring. So we are submitting an IRB for that right now, and we plan on analyzing those results later this year once we get those results. So what's next is that we're looking for more students to join the team. So if you are a P1 or P student here who is interested in anything that we talked about today. Our emails are on the screen, so reach out with any questions or expressing interest in joining the team. Thank you.
I was just going to add, Anna's also here, and she's awesome. Super interesting and grateful mentor to have her all semester. So,
also very grateful for Kailey and Nidhi for being on the team. In addition to also teaching me a lot, I had a lot more fun working with them than I would have otherwise. So very grateful.
Questions from the audience? So I'm kind of reading your mission statement here up there. How might we allow patients to conduct hard screenings from home? And I'm curious what you think the role of the pharmacist is in this, because I'm really interested in this. Don't know much about it. I think about how the role of the pharmacist in like remote CGM monitoring is growing, but I feel like that's an area where pharmacists are more comfortable. I can't say that I nor any other pharmacy student probably have competence in like auscultation. Where do we fit?
So within Korion, just specifically, one of the other things that they offer is educational services to patients. So with their product, one of the key aspects is it'll kind of give you some feedback on your heart sounds and then provide educational services to do that. So one of the elements could be, what medications are in your future if you're kind of leaning towards that. Like a congestive heart failure diagnosis, there's a lot of meds that come into that. So, being on more of the educational side, definitely, I think there's a role for pharmacists there. I also think one of the things that we kind of noticed through our research is that patients would like something like this in community pharmacies. And so being, someone in the community setting or someone on like in a clinical setting that can recommend this for patients, that they can start having their early screenings is, I think, another benefit that pharmacists could utilize.
Also chime in to an answer there. Or Nidhi, did you want to add anything? Go ahead.
So one of the lines that I used during our pitch was that although many people think that the goal of pharmacist's role is to put patients on medications, our goal is actually to take them off of medications. So part of our role is, being part of that transitions of care team and seeing, the diagnosis of the patient. And if it gets better, helping them get off of those medications so that they don't have to continue being on many different therapies that they possibly don't need. So, we're there for that, and we'll continue to be there for them throughout the whole process.
Yeah, okay, sorry. I think Nidhi and Kailey really hit kind of the nail on the head. The other thing I'd just like to add is that while we're starting with the go-to-market strategy of just creating the electronic stethoscope and the guided interface just so people can get screenings that they just can't get right now, I'd also think of this as a data collection tool. So I'm an MD PhD student doing my PhD in computational biology and machine learning, and I really believe in the power of ethically designed AI to really bridge these gaps in access. And originally the dream for this was to be an AI diagnostic, but then we're like, wait, we don't have any inputs. There's no way people can collect this data. And so we realized we had to do the stethoscope first. But I think, like Nidhi was saying, it seems like pharmacists are trying to take people off medications. So this could be a really interesting way to collect data on how different patients do on certain medications. And then we could work with pharmacists and be like, hey, which ones do you think are actually essential here? Can we take anyone off these medications?
I'm very interested in excuse me. I'm personally very interested in trying to identify adverse events in patients, drug-related, before they show up in the emergency room. So have you given thought, I'm sure you probably have, to using this as a tool to evaluate adverse events following the prescription of, I'm assuming you would start out with new cardiac medications. Okay.
So my clinical interest is in emergency medicine. So that's actually exactly what I was thinking when we started this idea. I just saw how many people came into the ER for, safer injuries for really preventable reasons, exacerbations of conditions that had gone unchecked. And I'll also say, I don't know if anyone here knows Dr. Eric Dewicki. He's the Director of Care Innovation at the Heart and Vascular Institute at UPMC. He's our primary faculty mentor, so he's really been critical in helping us direct where to take this product and how to actually make it both patient and physician or healthcare giver oriented. But yeah, I'll hold down the connect afterward if you have any more thoughts. Does anyone else have? Should I keep passing this around, or is that?
So I got a question about the users' perception, because for most of users, they are probably not very familiar with the telemedicine or telehealth. And my student, one of the presenters, Sneha, and I conducted a study about users' perception and adoption of telemedicine. And it seems like the underserved population, they might need this the most, but they are less likely to adopt telemedicine. So do you plan to do some like user perception or user related surveys like in the future?
Nidhi, what do you think about Pit Plus Me?
She deferred that question really well. That founder skills right there. Your thoughts, user perception.
I guess I'll take the question. So,
Sorry.
We are working on conducting a survey through Pit Plus Me to get more of that user feedback and see, where the gaps really are. So we're asking questions like, how often do you go into the clinic? How often do you get your heart screened? Would you be comfortable with using a tool or learning to use it on your own? And then part of our product that I don't think we really got a chance to touch on was also the component where the machine learning diagnostic tool is going to indicate to the patient where to actually place the stethoscope. So they don't have to know the 4 chambers of the heart and where to place it on their body.
Go ahead. I had something random for that.
They don't exactly need to know where to place it. They'll put it in place, and the light will be red until they put it in the right spot. Then the light will turn green on the computer, and that'll tell them that they have it in the right place.
I think this is also a good point. I know it's not a device for everyone. I know a lot of people would rather go into the clinic, but there are a lot of demographics that we've surveyed who actually have many barriers to making it physically into the clinic. Some of them are practical, like time or distance. A lot of them are psychological. There are definitely many patient populations. African Americans are one that come to mind that have undergone a lot of trauma through their community through medicine. My parents are also immigrant. They don't speak English well, and it's stressful to face the language barrier. Just to list a couple other examples, when I was in college, I worked with a group of women who are survivors of sexual assault, and I guess going to a doctor could be very triggering for them in some cases. So there's many people that have worse healthcare outcomes because they can't make it into the clinic. I think also the pandemic showed us that sometimes if someone's infectious with COVID, you don't necessarily want them coming into clinic, and we really are lacking in these tools to meet people at home right now. So, anyways, yeah.
Just out of curiosity, and I'm not sure if you guys already mentioned that in the presentation, but in terms of data, is this something that is integrated as part of a health profile or electronic system, or is it just accessible only for the patient, or is it shared with their providers?
So question, so it gets on the recording, the data. Where does the data go, or what's the relevance of the data when it comes to the outcome for what's being measured?
Do either of you want to take it, or I can take it too?
So I think to start, since we'll be targeting telemedicine companies first, it'll be available to the provider to analyze that data and then get back to the patient if they heard anything abnormal that they need to consult with the patient about and bring them in for further screenings. And then I believe for in the future, when we have that machine learning based diagnostic tool available for the patients, then they'll be able to access their own heart sounds and then they'll know on the spot whether something abnormal was detected.
I think the goal is the company's own system for having and hosting data as well.
Yeah, it kind of depends because right now our first letter of intent is from a telemedicine company, and I think they have their own system. So I think we'd like to have our own system, but they already have one. So we're still trying to figure this out.
Starting out.
Yeah.
So thank you again to our key 3 presenters. And what a wonderful presentation to end on, considering that it comes across so many topics that we'll talk about. So you can imagine the API, the Firebase that you could